Hello, team. My name is Amy Farkas from the Quality Control Council. Today we'll be talking about National Database of Quality Nursing Indicators, or the NDNQI. It is a database that measures the quality of nursing care on a state and national level. The goals of the NDNQI are to provide improved patient safety and patient outcomes by developing nursing sensitive indicators. These indicators reflect the supply, skills, and level of nursing staff, the process of nursing assessments, interventions, and job satisfaction, as well as outcomes that can be improved by better quality nursing care. The indicators are developed by identifying risks, collecting data from participating facilities, conducting pilot studies, and performing alternative reviews to determine validity. Only the indicators that are of the most value are added to the NDN-QI list. The current list includes several areas, including turnover rates in nursing, hospital-acquired infections, pressure ulcer rates, and many more. The indicator that we will be addressing today is related to patient falls and the process of collecting data and improving outcomes. Due to the high risk of falls and the fragility of hip fractures in older adults, there's an associated lower than average positive outcome percentage. The current outcome level post-fall for older adults includes impaired mobility, diminished function, and increased mortality rates. However, these outcomes can be improved by using quality nursing interventions and common care best practices to ensure optimal acute care. So next we're going to talk about ways to improve the patient outcomes and process by understanding the data collection and disbursement process in relation to patient falls. So we interviewed members of the safety committee to discuss the process of technology use and patient monitoring and asked how our company uses this indicator and what the process is to improve patient care. Before I share with you our process of data collection, I think it is important to mention how reporting and accurately entering data helps to obtain high quality results, and how by using tracking monitoring programs, it can assist with the nursing interventions to prevent falls and protect patients. It is every team member's responsibility to accurately report and record data in relation to their position and to the individualized patient care. So some exciting news, our company has partnered with the PA Office of Human Services, ODP, to offer us a data collection tool that can identify risks before they happen. So this tool is called the Health Risk Screening Tool Program, or HRST for short. The HRST is a web-based screening instrument designed to detect health destabilization early and prevent preventable illnesses, health-related events, and even death. It is a reliable, field-tested screening tool that consists of 22 rating items divided into 5 health categories. So all nurses and team supervisors, including nurse management, will be participating in initial training of the program. These individuals will be called the screeners. The screeners will meet monthly with the direct care staff and the support team to review and collect data on the patient's current diagnosis, medications, and current health status. This program will generate a score that will identify the patient's individualized health risks. It will then offer trainings and intervention the team can implement to lower the score and prevent the identified risks. The generated trainings will be used to develop curriculum to improve on future trainings for new and senior staff. The interventions will be reviewed with the nursing staff to collaborate with providers to form an effective individualized care plan. So during the screening process, the most important thing to consider is teamwork. Collaborative communication by the team is 100% vital to accurately input the data into the screening tool. It is vital to improve the quality of healthcare for our patients. There are many areas the data will be collected from. Some of these areas used to identify fall risk include mobility, nutrition, pain management, bone health, and constipation and urinary issues. So we'll be collaborating with many different providers, different team members to collect all the information that we would need um, to enter into to get the full picture of the patient. So when we look deeper into all areas of patient-centered healthcare, we can discover risks that are able to be lowered or prevented by using the interventions and the trainings provided by the HRST. So next, once the screening is complete, the screener will send the data to the collaborating team members and providers to make necessary changes to medications or care. To ensure that the proper data is input into the system, there is a clinical review performed by the medical coordinator annually. This will ensure the information is current and accurate. Trainings for the HRST to all nurses and screening staff are conducted quarterly and will be provided in person and virtually for all the screeners and the clinical reviewers. There will also be training for the direct care staff, not to be able to screen, but to know what information to collect for the screeners. So there will be HRST reports reviewed annually to identify the risks to see if the risk scores have decreased. In addition to the HRST screening tool, we will also perform fall meetings and environmental checklists to monitor alternative causes of falls that cannot be identified by the HRST. The environmental checklist is used to identify if a fall was caused by an issue within the facility, such as faulty handrails, stairs, lighting, or furniture placement. The HRST cannot pick up those types of interventions because we're only entering healthcare data. We're not entering facility data. So that's why we also need the environmental checklist to be completed so that the two tools can work together and are vital for fall prevention plans and the fall meetings, as well as patient safety. So overall, all staff, management from the top to the bottom will be a part of collaborating the data to help provide the best possible outcomes for our patients in regards to falls. We will use the tools provided, and we will have everybody trained hopefully within the next few months, and we will conduct reviews to make sure that these things are working properly. So thank you for your time, and thank you for being a part of our team.